Good evening, everyone. I'm Amy Lynn. October is Breast Cancer Awareness Month, and here at WJHL, we are taking this opportunity to share with you the latest information on technology, early detection, and local resources. Over the next half hour, we will be taking your questions, giving you answers that will make a difference. If you have a question regarding breast cancer, maybe it's about a certain treatment or about general risk factors, you can call the number right here on your screen. We have people standing by ready to take your phone call this evening. We want to begin by introducing our two guests with us tonight. At this time, we have Doctors Jocelyn Medina and Dr. Glenda Ramsey, both radiologists with Mountain Empire Radiology. And ladies, thank you both so much for taking the time to talk with us tonight.
Thanks for
My
having
pleasure.
us.
Yes, thanks for having us.
We have certainly been getting to know and talking about just how things have changed, and we have so many questions and a lot of information to get out to our viewers tonight. But let's start with a little bit of an introduction and maybe some of the background so our viewers can sort of get to know the part you play when it comes to breast cancer awareness. We'll start with you, Dr. Ramsey.
I've been locally here for 27 years, and breast imaging is actually my specialty. Mountain Empire works throughout the Mountain States Health Alliance, so our main facility here in Johnson City is the Women's Health and Imaging Center. I now have a special interest in integrative medicine, so I'm bringing more of the integrative medicine approach, lifestyle, diet, things like that that can help with breast cancer treatment and breast pain treatment. So I'm kind of focusing on that as well now.
Wonderful. And Dr. Medina?
Yes, I've been practicing in mammography and radiology for about 10.5 years, and at the Women's Health and Imaging Center, we focus a lot on detection of breast cancer and diagnosis of breast cancer. And we also, help women with any kind of breast symptom in our breast clinic. And hopefully, I think people come in nervous to see us, and I think most of the time they leave feeling much better and having had their questions answered.
And certainly we were talking over the years just about the changes in technology and when it comes to breast cancer and mammography and how important that is. Tell me about some of the changes you guys have seen in the technology and what is available now to women when it comes to the fight against breast cancer, because I can only imagine how quickly things change in the medical world.
Well, the digital imaging now, which the computerized imaging, is far better at detection, and there's just a lot more resources related to that. Also, the interchange between physicians, I can call somebody and get another opinion right away. I think also the thing that's really helped is the way that we can do biopsies and things. Women frequently don't need to go to the operating room before we can make a diagnosis, and that really eases a lot of discomfort, how long they have to wait, and it's just that whole aspect of the core biopsies and things, I think, has drastically improved women's care.
Because of course that waiting period is so painful, and you want that information right away as quickly as possible.
That's absolutely right. I mean, there's not any woman that once she realizes she has to have a biopsy can do anything but worry about it. And so we are able to, get the diagnosis quickly for patients, and I think that helps them move on to the next step if they have to, or else, not have to worry about it anymore. And we also have a lot of other modalities that we use with breast cancer detection, like ultrasound and even sometimes MRI for certain patients, and both of those are great tools to help us with the mammography that we also use.
So there are a lot of different tools now that we can use to make sure and maybe get a better look to see what's going on inside the breast.
And a lot of problem solving so that they don't have to go to surgery, because very few women actually have breast cancer when they come in with a problem. Most of the lumps, most of the pain, it's really not breast cancer. And so these tools really help us narrow down, so the women that do have to have a biopsy or that sampling can be just the few that really have we have a more serious concern. I think another thing is that we really work as a team with the other clinicians that do breast work. In fact, this morning we have a conference every other week with our breast surgeons, our pathologists, the radiation therapists, the medical oncologists that do the chemotherapy, and we work as a team in a group, and I think that's something that's changed too. It's really an interdisciplinary approach because it's such a personalized thing. Every patient that has a diagnosis really is a different road for them to to travel. They're just different types of breast cancer. The staging is different. How old they are, other medical conditions. There's so many things. And so what happened with your Aunt Minnie or the lady at church really may not even apply to you. And we try to educate the patients about that, but we also work with a lot of the other clinicians locally to help make sure the patients get really good directed care that's not just a little, us doing one thing and them doing another. It's far more connected than just the electronic record. But that's also another thing that's been a benefit, is that all the sharing of the information to the electronic records at Mountain States.
I was going to say, we talk about that team approach, and every particular cancer is different. Like you mentioned, everybody has a completely different situation that they need to travel.
Yes, that's right. And I think a lot of people don't realize how everyone is working together, and because we work together, we really treat breast cancer. It's state-of-the-art treatment we have here in this region. And a lot of people think, well, do I need to go away to a special place to get my breast cancer treated? And the answer is no, that we have here in this region, excellent people who take care of breast cancer patients. And we do a great job with it, all of us together, working together. So.
We are definitely blessed in how far we have come when it comes to treating and diagnosing breast cancer. And of course, we talked about mammography, and I know a lot of times the recommendations are a little bit over here and there at this point. So I wanted to ask you, what are your recommendations when it comes to how often a woman should have a mammogram and when they should start? Because it seems like we're seeing younger and younger women being diagnosed.
Yes, I mean, there is some controversy about when women should be screened because there are different, entities making recommendations. In our American College of Radiology, the recommendation is to start yearly mammography at age 40, but there are other, recommending sources that may say between 50 and 70. But it is, I think, our opinion that, and especially here in this region, that we would recommend mammography screening from age 40 on and every year. And I know you might want to comment further on that.
Well, yeah, today I actually saw, we've had 2 patients just in my practice today that were under the age of 40. So that's, these women have young children. I mean, I'm not suggesting they should be screened under the age of 40, but it's just to show you that there are definitely, those recommendations that wait till 50, I think are really, we would be missing quite a few people we can make a difference in. And that's where we're coming from with that recommendation.
That year can make a big difference, I would imagine, in the size that we're dealing with, and now the treatment and everything sort of changes in that time.
That's exactly right. I mean, your stage of breast cancer, the lower it is, the sooner we find it, the smaller the tumor and the greater your chance of surviving your breast cancer. And anymore, there's not any reason to die from breast cancer if we can just find it on time. It is not typically a lethal disease as long as we can detect it. And that, as long as we find it, we just have to find it. And if we're not screening people, it'll be harder for us to find it.
Early detection continues to be key. Ladies, we thank you so much for joining us. Again, we're going to take a quick break here. This is the number if you have a question and you would like us to ask it to one of these radiologists. We'd be glad to do though. Call in your number, call in your question, and we will get it to her in just a moment. We're going to take a quick break. 1 in 8 women will develop breast cancer in the United States.
I was one.
Early detection is your best defense, and that means monthly self-breast exams and yearly mammograms.
A mammogram can find breast cancer when it's small and easier to treat.
I felt a lump.
Self-breast exams once a month and mammograms once a year. Early detection that could save your life.
When you walk, I get a friendly face to take me to treatment. And when it's out of town, I even have a place to stay.
When you walk, you're funding research that could save my life and providing answers when I need them.
When you walk,
I get the support I need from someone who's been there, and I get a whole new look.
And when we walk, we make strides. Help us finish the fight against breast cancer. Gather your team today and make a commitment to your local American Cancer Society. Join us and make strides this October.
Doctors told me the drug probably saved my life.
Research around the world is making a huge difference in the fight against breast cancer. It is saving lives.
We have come a long way, but women still die from breast cancer. We can definitely do more.
Do more, like raise awareness and funds. It's about finishing the fight.
We are close. We are making progress.
Walk with us, do your part, and let's finish the fight. Welcome back to our special presentation tonight. We are taking your questions and giving you the latest information on the fight against breast cancer. We want to welcome back our guests this evening. We have doctors Jocelyn Medina and Glenda Ramsey, both radiologists with Mountain Empire Radiology. And ladies, thank you again for joining us. Getting a lot of questions in tonight, so we want to get right to them as it's only a 30-minute program. We were talking earlier, we could talk for several hours and still not cover all the information. So one lady did call in wanting to know about some lifestyle things. Does alcohol increase your chance for breast cancer, and can exercise help prevent breast cancer? And you were going to answer that.
The studies have shown that alcohol consumption does indeed increase your risk of breast cancer. Part of the reason is that it affects your liver and the whole detoxification and things like that. So that's a definite yes. The exercise is a tad bit more controversial, but most of the studies are showing that exercise is the magic pill for about every chronic disease, including cancers. So there are some specific trials in breast cancer. They've been a little bit mixed, but in general, exercise is definitely recommended to tolerance. But I would caution that you don't need to go out and start exercising if you've been the couch potato. You need to talk to your doctor if you have any chronic disease or over the age of 40.
And Dr. Ramsey, I'm guessing a lot of women at home, follow-up question, is there anything I can be doing to reduce my risk of developing breast cancer?
A plant-based diet, meaning a lot of fruits and vegetables, actually the vegetables first and the fruits. A low glycemic diet, which means not a lot of sugar, that tends to increase risk of breast cancer. And then at the Women's Center, we do recommend a few supplements like flaxseed and fish oil. Those are, basically eating healthy, getting enough sleep, reducing your stress, and exercise.
It's a wonderful world right there. Our next question that came in asking about 3D mammography, starting to hear a lot more about 3D mammography.
Yes, 3D mammography, or breast tomosynthesis is another name for it, is another great tool we have for detection of breast cancer. And we think, again, this is an emerging technology, and not everything is known about how it will exactly impact survivorship of breast cancer, but we believe that it can allow us to detect cancers, especially in denser breasted women, more efficiently, and also help with us calling patients back who don't actually have a problem. So we, a lot of times in mammography, call patients back to have other pictures done, and usually that turns out okay, there's no problem, but we have to call them back and do other pictures. With breast tomosynthesis, this should reduce the amount of people who have to come back who don't need to, so decrease the inconvenience that patients sometimes have with mammography.
And that is something you hear is don't panic right away if you get that call back from a mammogram. It could be that they just need to check something a little further. All right.
Most of the time it's not cancer.
Something that they can treat.
Or something, when you compress the breast into two-dimensional, when you compress the breast, there's a little puckering on the edges and other things like that, and that a lot of times is all that it is, but there's no way for us to know that from the initial mammogram. We have to do a couple extra images, sometimes an ultrasound. So yeah, the tomosynthesis is going to help that situation because it's really kind of that 3D look.
Okay. And then a follow-up question to that, MRI imaging, is that a good idea when it comes to breast cancer too? And I think you guys sort of touched on that at the beginning of the show, multitude of different types of screenings now.
Yes, actually MRI is probably the most sensitive test that we have for breast cancer. However, it's really not for everyone. It is a long test that you have to lie on your stomach for. It is difficult for some patients to have that done. It's an extremely expensive test. Really we use MRI in patients who have a very high risk of breast cancer. So that's typically who we use it on for screening. And we also use it for patients who have been diagnosed with breast cancer in order to help the surgeon decide what type of surgery is the best surgery for the patient, in order for them to see exactly where the cancer is so that they can get it all out of the breast. But yes, we use it on certain populations of women, and it is a great tool also. Again, not the easiest test for every woman to have, and also can, in some cases, be prohibitively expensive for patients.
Another question we got was actually on the process. What should I expect if I am called back in from a mammogram where something looked suspicious? What happens next?
Well, it depends on what we see on the mammogram. If it's that puckering type thing on the edges, we'll usually you do slightly different angles and things like that. Some patients are called back because we see what looks like it might be a lump, and usually those lumps are not cancer. They're usually fluid cysts. They're benign tumors, non-cancerous tumors. We would typically do an ultrasound. Some things are little tiny specks of calcium, and most calcium in the breast is not serious, but we take some specialized magnification views where we can really study those calcifications and try to decide if they look serious enough to sample or if they look like fibrocystic disease, which is a benign condition. So it's very tailored, just like breast cancer treatment is tailored, so is the diagnostic side, very tailored. And the radiologists, when they see that first screening mammogram, they make a recommendation for the other radiologists that would see that patient coming back in, what they would recommend, and then we kind of go from there. I do want to clarify that when you come in with no problem, that's called a screening mammogram. That's a situation where you may be called back in. We don't read those online. It's not efficient to do that. We would not get our work done if we did that. So we read them routinely with no interruptions, so we're very focused and much more accurate. But we do read the diagnostic mammograms. Those are done when patients have come back in because they have a screening problem, potential problem, or they come back in because or they come in the first time because they have a lump or a nipple discharge or some problem that might be serious. That's a diagnostic mammogram. They're much more tailored at that point. The radiologist is always attending, watching what's happening during that procedure, making decisions like right then and there, so the patients know the answer pretty much when they leave from that diagnostic study. So there is a difference in the type of mammography. I think that patients a lot of times are confused.
And that's interesting that you bring it up. So you guys are actually there during that process, so you're able to see and have them move perhaps in a different way, so you can really. And that's nice because then it's that instant that they're gonna know something.
Right.
And I think too, again, there's not a single woman who gets called back for her mammogram who isn't instantly convinced that she's got breast cancer and it's going to be terrible. And so, having them come in and being able to talk to someone about what's going on and to know for sure what the plan is, I think gives people a lot of comfort. And most of the time, that's good news. There's no problem. We don't see anything suspicious, and you can go back to your yearly exam. But sometimes, if it's more serious, we take additional steps and we work through the problem until we've come up with what the final plan needs to be for the patient.
And they know right then. So even if it's you need a biopsy or this is serious, we're there. I mean, we're breast specialists, and we're there to answer the questions. A lot of times, the primary care providers, which are great for their hypertension or their diabetes and things like that, but it's not their specialty, and that's one reason that we do individually see and talk to patients many times while they're there to give them that answer and and to kind of ease their mind, even if they have a road to travel, because it's sometimes easier to know that there's a problem and you can just kind of get directed at it rather than just worry and wait for the phone call or whatever to find out later.
And to be able to answer those questions and at least have peace of mind that this is our action plan.
Right.
I know the steps that I now need to take.
And why.
Exactly. We want to thank you both so much for your time this evening. Certainly appreciate it. We continue our viewers. If you would like to ask a question, go ahead and call in that question. We will get it to them, and if we don't within the half hour, we will be sure to get back to you with your answer. We're going to take a break. When we come back, we have two other guests that we're going to introduce you to, so stay with us. 1 in 8 women will develop breast cancer in the United States.
I was one.
Early detection is your best defense, and that means monthly self-breast exams and yearly mammograms.
A mammogram can find breast cancer when it's small and easier to treat.
I felt a lump.
Self-breast exams once a month and mammograms once a year. Early detection that could save your life.
When you walk, I get a friendly face to take me to treatment. And when it's out of town, I even have a place to stay.
When you walk, you're funding research that could save my life and providing answers when I need them.
When you walk,
I get the support I need from someone who's been there, and I get a whole new look.
and when we walk, we make strides. Help us finish the fight against breast cancer. Gather your team today and make a commitment to your local American Cancer Society. Join us and make strides this October.
Doctors tell me the drug probably saved my life.
Research around the world is making a huge difference in the fight against breast cancer. It is saving lives.
We have come a long way, but women still die from breast cancer. We can definitely do more.
Do more, like raise awareness and funds. It's about finishing the fight.
We are close. We are making progress.
Walk with us, do your part, and let's finish the fight. Well, welcome back. We thank you so much for tuning in tonight. We have some new faces here with us now. We want to welcome Holly Booker with our local American Cancer Society, along with Carolyn Owens, someone who knows firsthand what it is like to fight this fight. And we thank you ladies so much for being here.
Thank you.
We want to start with you, Carolyn, because as we continue to hear about the technology and the treatment, I know that you have walked that road. You were diagnosed at the age of 26.
Yes, it was actually 3 days before I turned 27. So at 26, you don't hear the words you have breast cancer.
Yeah, you're not supposed to.
No, not at all. When you're 86, maybe, but not 26. I was in a complete shock.
So what happened? And did you feel something? Did you, because at that point you're not being advised to go in for a mammogram.
Right. My mom was actually a survivor at the time, and she always told me do self-exams, do self-exams. So I did, and I found it after being at my my gynecologist less than a month before. I found this lump and I said, this isn't right. So I go to the doctor and they say, oh, it's probably nothing, just a fibroid or something because you're so young. And I said, I don't care, I want it tested. So they did an ultrasound. Oh, it's perfectly round, I'm sure it's nothing. I said, but I want it tested. So they finally did a biopsy, a needle biopsy, and it came back cancer. I go to see my surgeon and he walks in the room and he says, under a microscope, it's cancer. Yeah, I didn't even get upset until he told me I was going to lose my hair because I knew that my mom had already beat it.
So for you, and that brings us to the American Cancer Society, because I know, and we sort of can laugh now. She's been cancer-free for 7 years, but that's something, and that's what women, that's part of it, you know, it's who we are, it's what we see, and I know you guys were a great support, and you can help people through that.
We can, and that's really why we're here, for people like Carolyn and anyone else who gets diagnosed and has a hard time with anything, whether it's a ride or a wig, or they don't know where to go. We have a 1-800 number. We're the only nonprofit who has a 1-800 number that's available 24 hours a day, 365 days a year. So if someone like Carolyn does go in and they get diagnosed, they don't know the next step to take, you can call. Or if someone goes in and she's totally comfortable with having a mastectomy, although not many of them are.
Yeah.
We have a wig when that's an issue. You can come on in and we'll take care of that for you.
How important was that support for you?
It was so important. I went to the Look Good, Feel Better program after being told about it. As soon as I was diagnosed, there was a nurse that came in and she said, the American Cancer Society does this, 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 and this. And when she said the Look Good, Feel Better program and you get to play with makeup and try on wigs, I said, I want to do that. So I did, and I found a wig, a perfect wig, and it was so cute. And I did the mastectomy bra because I did have a complete bilateral mastectomy. And then I started volunteering with Look Good, Feel Better, and I did that for probably 3 or 4 years. I ran the program for a while, so it was a lot of fun.
And that's what we see a lot too with the American Cancer Society. Someone helps someone through the process and they want to give back and help the next person. It's very pay it forward.
It is really pay it forward. And a lot of the people who will meet survivors who come in, you know, this made a difference to me. Someone reached out to me and they were there and they supported me emotionally, or they gave me a ride to treatment, and it made all the difference. In this horrible time in my life, this made a difference. So our volunteers, we're volunteer run, and they're coming back to pay it forward just like that.
And now you're also involved in the Big Strides Walk, the Making Strides Against Breast Cancer campaign, which WJHL is taking part in, and you guys have been doing this for a few years now. Very successful, coming up at the end of the month.
Yeah, we're really excited about it. It's at Founders Park on the 30th. Registration begins at noon and the walk's at 3. Everybody can come out. Everybody just come out and bring all your family and all your kids. It's going to be a lot of fun.
And Holly, tell me why this is important. Where does the money go through the Making Strides Walk?
The money raised goes to restricted breast cancer research funds. Right now, the American Cancer Society has about $74 million invested in breast cancer research. And because of that, since about 1989, we've had a decrease in death rates for breast cancer by about 36%. And if you do the math, it's about 249,000 lives that have been saved because of that research. Tamoxifen, that's a drug that a lot of breast cancer patients take after they're done with their treatments. That's an American Cancer Society drug, and it's what keeps it from coming back. So we do that research. Again, 74 million. It's a lot, but 36% is a lot. It's almost 250,000 lives. That's a lot of birthdays.
And I know when I got involved at the American Cancer Society and what you guys are doing, to read about how far we've come, and we've talked about that with the technology and the treatment, and it is amazing to see the strides that have been made.
It is amazing. Even if we've got a few survivors who are diagnosed with similar cases just 5 years apart, and to hear the difference in their treatments, like whether they had a lumpectomy or a double mastectomy, it's different, and you can tell it's time. We're getting better. The treatments are getting better. It's getting better every day.
And Carolyn, I know you continue to reach out to others to share your story, especially in the unique situation that you're in with as young as you were diagnosed.
Yeah, I have been a part of the Reach to Recovery program for several years now, where I reach out to women who are newly diagnosed of all ages, but mostly people tell me to call the younger ones because they don't think that it happens to them, and I'm proof that it happens and it can be beaten. 7 years, I'm still here, so it's a wonderful program. I love it.
And your advice to others out there as we have this program and we're about to come to the end, just your advice.
Self-exams are so important. Always check, always know your body. You know your body better than anybody else in the world. And do your mammograms if you're older. If you feel something that you know isn't right, have it checked out and don't stop until you feel comfortable with it.
Got to continue to push. And Holly, I know you continue to have the programs, you have the 1-800 number, and you want to help.
Yeah, we do want to help, and we want everybody to come out and get involved too. We have so many breast cancer survivors in the area, and they really could use all the support we can give them. So October 30th, we're going to line them up on the start line, and we're all going to follow them for 3 miles as they cross the finish line. And we'd love for all of the Tri-Cities to come out and do it with us, because it will be a huge day to celebrate life and celebrate them. So we would love everyone to come out.
All right, well, we're going to give everybody the information, cancer.org, for more on the Strides Walk locally in our area. I am going to be there. I hope you will come out and join us. Wear your pink. It is a day of celebration as we continue to make strides. And ladies, we thank you so much for joining us. Carolyn, thank you so much for sharing your story and for continuing to give back to the community.
Thank you so much.
All right, that's going to do it for us. That's all the time we have. If we did not get to your question, we will try to do that coming up later on after the show.